We have no new deaths, and currently 3 individuals are in our regional hospital, and we don't have anyone in the intensive care unit. The number of outbreaks in our long-term care homes and our retirement homes has fallen since the previous week from 7 down to 4. Because of your careful adherence to all of the public health measures, this is why we're heading in the right direction and our numbers continue to trend down. I also want to talk to you today about variants of concern. Many of you have read or heard about the variants of the COVID-19 virus. Viruses naturally mutate and change. These mutated viruses
Dr. Locke, sorry to interrupt. You are on mute.
All right. Sorry about that. Okay, good afternoon, everybody. I'll start today's media briefing with a look at our most recent data. Today we have 7 new cases, bringing our active confirmed positive cases to 116. We have no new deaths, and currently only 3 individuals are in our regional hospitals, with no one in the intensive care unit. The number of outbreaks in our long-term care homes and retirement homes has fallen since the previous week from 7 down to 4. Because of your careful adherence to all the public health measures, our numbers continue to trend in the right direction. I'm also going to talk today about the variants of concern. Many of you have read or heard about the variants of the COVID-19 virus. Viruses naturally mutate and change. These mutated viruses may be more contagious, may make you sicker, and may prevent the new vaccines from working. We call these variants of concern, or VOCs. There are currently 3 known variants of concerns circulating internationally. Each of these variants have been identified in cases in Ontario. These variants have been shown to spread more quickly than the original strain. Because of that, we all need to focus on preventing variants from spreading. I want to remind everyone of the early days of the pandemic when we were all very diligent in doing public health measures correctly and encouraging those around us to do the same. Your face covering should ideally be made of 3 layers, 1 to act as a filter, and it should fit snugly around your nose and chin with no gaps. You should sanitize or clean your hands before and after putting your face covering on, and before and after taking it off. You should wash your face covering after each use. Also clean or sanitize your hands before and after you touch objects like doorknobs and when you enter and leave buildings like grocery stores. Be sure to stay a full 6 feet away from people you do not live with. Stay home when you have symptoms, even if they are very mild, and get tested if you have symptoms or been in contact with someone who has tested positive. Please continue these actions now. We've been at that for a whole year and we're getting tired, but as these variants start to come around, we need to be extra diligent. I'd also like to provide an update on our vaccination plan. We are eager to bring vaccines to you and your loved ones as soon as vaccine supplies are available. Right now, our team is administering 2nd doses to area long-term care homes and high-risk retirement home residents. Those should be wrapped up very soon. Mass immunization clinic planning is underway with our partners. We hope to have an announcement on locations and plans for when groups will be able to visit these clinics in the near future. Sequencing of the vaccine will be based on age first, as we know the most serious impacts are to those of advanced age. The province makes the decision on sequencing of immunization, and then local health units carry out the work. There is currently vaccine scarcity in the province, so we will move ahead cautiously. As soon as enough doses are available from manufacturers, our goal is for everyone in our area to get COVID-19 vaccine by September 1st of this year. Moving on to shutdown, the provincial government has indicated that they will be moving our region back to the color-coded framework as early as February 16th. Our local data will inform their decision-making and determine what color we will move into. We know everyone is anxious to know what stage we will be in, and we will communicate that information widely when it is available. Public health and workplace safety measures, including staying home as much as possible, will remain essential going forward until significant vaccination coverage can be achieved. So this concludes my remarks, and I'm going to hand it back to Carla to facilitate any questions.
Thanks, Dr. Locke. I'll now open it up to questions. Please raise your hand if you have a question, but I will start with Kathleen Saylors, Woodstock Sentinel Review. Please unmute your line. Hi, Kathleen, do you have a question? Okay, I'll come back to you. I'll now open it up to the individual who has called in at 633-6936.
Hi, Dr. Locke. It's Ian McCallum at MyFM.
Hello, Ian.
Hello, Dr. Locke. I have a question that's related to well, it actually is the coronavirus. I'm wondering, over the long course of a year, and all that you've had to do with contact tracing and all the other elements, vaccination, what has the impact of that been on your budget? How seriously is that making a dent into your budgets ongoing?
The health unit has been working hard all throughout the last year. Many of our staff have worked long hours and put in many hours of overtime. And this has happened not only in our health unit, but in other health units across the province. It also has happened in a lot of other sectors that have had to put in extra hours, such as the Ministry of Labour, the Ministry of Long-Term Care, and workers within those in those sectors of our population. The ministry is working it out with all of these organizations to ensure that there is additional funding as needed to support the extra hours that everybody is putting in to try and keep our province safe.
Thanks, Ian.
Thank you.
I will now open the line to Chris McMillan at Heart FM.
Thanks, Natalie. Hi, Dr. Locke. Thanks for taking my question. Can you give us any indication what might happen come February 16th? Where are our numbers trending? Looking at the numbers that I'm seeing with active case counts, it would look like we wouldn't be in the gray lockdown zone, but I'm not the expert. So can you give us some kind of indication where we might be heading if the numbers kind of continue or don't spike over the next couple days?
Well, I think everybody's hard work to try and keep COVID under control locally is paying off. So yes, we can be assured that we will not be in the gray lockdown. Our numbers have been hovering between red and orange. That said, that's not the only indicator that is used to make that decision. So other indicators are things like how has the health unit been able to do in sort of managing the workload? How have our healthcare system partners, such as the hospitals, been able to manage with respect to ICU beds and inpatient availability? So all of those factors will be taken into consideration. And of course, we will also be watching, I'm sure the province is looking carefully at these new variants of concerns and where they're popping up. So all of those factors will play a role. So I suspect we're either going to be red or orange, and we should know from the province, hopefully by the end of the week, where we land.
Thanks, Chris. Sorry, I was on mute. I'll now open it to Greg Colgan, Woodstock Sentinel Review.
Great. Thanks, Natalie. Hi, Dr. Locke. I was just wondering, in regards to the current outbreaks at Crescent Care and People Care in Tavistock, just with Maple Manor having been resolved, is there a breakdown of how many active cases there are between Crescent Care and People Care right now?
Yes, so one, we're very pleased that after 2 months, we've been able to wrap up the outbreak at Maple Manor, but we do have ongoing cases at People Care. As of this morning, we had 85 confirmed cases associated with People Care Tavistock, of which 47 were residents and 38 were staff. And at Crescent Care Retirement Home in Woodstock, as of this morning, we had 69 confirmed cases, of which 51 were residents and 18 were staff.
Thanks, Craig. I will now open the line to Rob Perry, Aylmer Express.
Hi, Dr. Locke. I just wanted to ask you about Maple Manor, just in retrospect now that it's over. Do you think the death rate there was fairly high? It was over 20% from what I can make of the numbers for the residents alone. Do you think that's being communicated enough, the dangers that these things face when they do get into such congregate living settings, and how quickly they can spread and how lethal a menace they are?
Yeah, Rob. So that's a good point. So I think the key message here is that as time goes by, we are learning that the virus spreads easily in households, and congregate care settings like long-term care home and retirement homes are a form of a household. It's their home, and so we all need to be extra careful in our home setting, and that's why we often ask people who are positive to ask their family members to stay home as well until we're sure they don't have the infection. And in the same way, we need people who have any concern about being ill in any kind of way to not visit the long-term care homes and retirement homes. The other thing that we know quite clearly is the older you are, the higher your risk of getting very ill and dying. And that's why when we start rolling out our vaccine campaign, our first focus will be to start vaccinating from the older groups of people and then moving down slowly towards the younger ones. So I think our priorities, as we have already shown right now, it's been the residents in long-term care and retirement homes for vaccine. And then we will make sure that our front-facing acute healthcare workers also are protected. But right after that, it will be starting with trying to vaccinate as many people. The older you are, the more up front in the lineup you're going to be.
Thanks, Rob. I will now open it to Shane Ketnis, Rogers TV.
Nothing today, thanks. Everyone's covered it.
Thank you. And back to Kathleen Sailors. Did you have any questions you'd like to ask today?
Hi, sorry, this is Carla on the line. Kathleen's been having some issues, Dr. Locke, so she texted in or messaged in her question for you. So I will ask it for her. Maple Manor being resolved, what are the next steps forward? And with so many residents with some level of immunity, vaccine or from the virus, what is the ongoing risk?
So we are going back in either we're doing it now or we will next week to ensure that everybody at Maple Manor and in all our other long-term care homes are getting the vaccine because early evidence is beginning to show that even in those people who have some immunity from having had a natural infection, that their antibody levels are boosted if you then give them a shot of the vaccine. So we're trying to ensure that all of our staff and residents in these facilities are maximally protected. Other research is beginning to show that those who have received the vaccine don't appear to be transmitting it, or their viral loads are lower, and that translates to mean that you have less of a chance to transmitting virus to those around you. So hopefully the impact of the immunization will protect both the residents and the staff there, but also make them not as likely to give infection to anybody around them. So hopefully the picture in our congregate living settings will start to look better in the coming weeks and months. And we'll just have to see how long this immunity lasts for. That's not yet clear.
Thanks, Kathleen. Please raise your hand if you have another question that you would like to ask before the end of the teleconference. I'll open the line to Rob Perry, Elmer Express.
Hi, I just wanted to ask, when we do come out to either orange or red or whatever on Tuesday, do you have any concerns about what people might do, feeling freed somewhat, that would then increase the risk to see another spike, another upward trend?
So yeah, I am concerned. We've all been very much shut in, and that's had an impact to our mental health. And I think there will be real excitement about being able to go into a store more readily or into other facilities that open. And so, but we are asking everyone to try and temper that excitement, and the advice is still to try and stay home except for what is really essential. So we certainly aren't out of the boat yet. We still have cases every single day at our health unit, so COVID is still out there, and the variant of concerns spread more easily. So I think the message from us is, okay, go out wisely to the store or to another facility when you really need to, but do stay away 6 feet and continue with all those interventions that we've asked you to do to try and stop the spread of the virus. It's so important because we don't want to go into lockdown again.
Thank you. Chris McMillan, Hard FM. Hi, Chris. If you have a question, we'll follow up with you afterward. We'll hand it over to Greg Colgan, Woodstock Sentinel Review.
Oh, yeah, Dr. Luck, just with the numbers that you gave for the outbreaks that are happening, are those the total still active cases, or are there some that are resolved? For instance, the 51 resident cases at Crescent Care and 47 at People Care. Are those all the active, or are some of those are resolved right now?
So at the Crescent Care, there are 47 residents who are still active cases. We had 51 cases in total, so 2 have recovered and 2 have passed away. That's for the residents. For the staff, we still have 8 active cases and 10 have recovered. For People Care, out of the 47 residents cases, 37 have recovered and 10 were fatal. So there are no more active cases among the residents. For the staff, there are still 2 active cases, but the other 36 have recovered.
Thank you. I don't see any more hands up, but I do know we have Ian McCallum on the line in case he has a question because he can't raise his hand.
No, I'm good. I think everything's being covered. Thank you.
Excellent. Well, thank you all today for participating. That concludes the end of our teleconference. Thank you. Have a good day.
Thank you.